morning, and welcome to SSHCO's Winter Town Hall. I'm Kimberly Hobson, CEO of the Southside Healthy Community Organization. And for me, it's always a good morning when I get to talk to our partners, our friends, staff, and the larger community about the great work that we are doing. We don't take it lightly that you are present today. The work we do is only possible because of you, and so thank you. Today, we're here to talk about the one thing that drives us every day, and it even drives us at night. It's impact. I'll share some of our recent impact numbers, introduce you to some of the faces and the partners behind the work that we do, and share one of our many maternal health success stories. But before we dive in, just a few quick housekeeping items. If you'd like to turn on your captions during the town hall, just click the CC button at the bottom of the Zoom screen. This feature supports translations in Spanish and in other languages. Also, we hope we inspire a lot of questions from you today. And so if there's anything you want to ask or to know, please drop those into the chat and we'll come back to them during our question and answer session. I also want to acknowledge the importance of this moment. As we celebrate Black History Month, I've been thinking about how much our work feels like a part of the larger arc of Black history. That's because the South Side is such an important part of this history. We know how the Great Migration created strong Black communities on the South Side of Chicago. But for years, these communities haven't had the same access to healthcare services and support services as many Chicagoans have in other parts of the city. And so despite these inequities, I know we all have deep pride for the South Side. And as someone who was born and raised right here in Auburn Gresham, I know that my personal responsibility drives me to do this work, and I know it's what drives many of you as well. We asked a few members of our team about Black history moments and what it means to them. And so our amazing community health worker, Robert, said that February is a time to celebrate our past, our present, and our future, and those who have impacted our lives. He sees the deep need that our communities face every day, but he also sees the progress and neighborhoods improving. That is so great. For Kiana, our maternal health program manager, this month is about legacy for her. She said it reminds us that we must actively work toward equity, dignity, and better outcomes for everybody. And for our community health worker, Brittany, Black History Month isn't just February, she said. It's something we live each and every day at the SSHCO. That's beautiful, Brittany, and I certainly agree with that. Here at SSHCO, we focus on making history one patient at a time, one resident at a time. And the way we do that is through our healthy community model. So here's what's important to remember. About 30% of a person's health and wellness is determined by what happens inside of a doctor's office or their health care, so to speak. Now, the other 70% is driven by whether their social needs are met. And so our community health workers and our nurse care coordinators here at the SSHCO, we address both sides by getting to know our patients as individuals. We are committed to connecting our residents with a primary care doctor, mental health resources, access to specialists and primary care doctors, transportation to appointments, workforce development services, and affordable housing, and so much more we do here at the SSHCO. And while we tailor the support we provide to the individual, our results are reshaping the entire South Side. Since our inception, we've enrolled more than 22,000 patients in care coordination. We've also made over 150,000 appointments to our subsidized providers. This coordination has led to incredible results on the South Side. Patients currently enroll in our programs Patients currently enrolled in our programs visit the emergency room 70% less than they did before they enrolled in our program. And people who have graduated from our care coordination program visit the emergency room 50% less often and have 43% fewer acute care inpatient visits. Now, that tells me that the Southside Healthy Community Model works. All of this has led to a $12.7 million less in medical costs, and that reduces strain on the medical system that serves us all. We are so proud of those numbers because they're proof that our model works. But we all know that numbers are only one part of the story. What we really care about is the people behind the numbers, because system level change is really a collection of small individual changes that add up to something transformative as our goal is to transform health on the south side of Chicago. And so we care about the new moms who get comprehensive prenatal care for the first time. We care about helping the young adult find safe housing and get the mental health care that they need. We care about the young family who now has access to fresh food, and even the grandmother who has her diabetes under control so she can watch her grandchildren grow up. So, yes, the numbers are impressive, and we share them every chance we get. But every single patient is more than a number to us. The SSHCO has been in existence for 4 years now, and we are excited about the path forward. In 2025 alone, we enrolled nearly 6,000 new patients into our programs. And this year, we're preparing to grow even more because all Southside residents deserve to be healthy and to truly thrive. So thank you for being part of our family and for helping us deliver our model across the 15 zip codes that make up the South Side of Chicago. And most of all, thank you for standing with us as we work to close the health equity gap on Chicago's South Side. Now, I am thrilled to welcome someone whose leadership has been paramount to the success of this organization. As president of Advocate Southside Healthcare Transformation and Advocate Trinity Hospital, Dr. Michelle Blakely creates a positive, empowering culture throughout her organization. And as board chair of the SSHCO, she helps to uphold the values of our organization. And personally, she inspires me each and every day. Please help me welcome Dr. Michelle Blakely.
Good morning, everyone. And Kimberly, thank you so much for that amazing introduction. Just listening to your introduction makes me feel proud of who I am. And so I'm grateful to you, and I'm grateful to be a part of this work. It's something that I'm absolutely proud of. I grew up on the south side of Chicago as well. And I've spent many of my, I hate to say this number, but almost 4 decades in this field, working in a lot of very different places. And I was really intentional about coming home to lead on the south side. There is often a misunderstanding, even a misinterpretation of who we are as a people and who the people are in this community. But I know, because I'm from here, that this community has a strength and extraordinary potential. And what every resident deserves is access to healthy quality care, access to opportunity, and access to resources that enable us to live healthy lives. That's why the Southside Healthy Community Organization matters so much. SSHCO is also an example of the fact that health equity does not happen by accident. It happens because leaders make the intentional decision to come together around a purpose. That's how the SSHCO was created. And it takes a lot of intention to commit to the kind of change that we're seeking because it can really be hard work. Every single day, our community health workers and nurse care coordinators are trying to close care gaps and navigate very real social challenges that affect health outcomes even more than what happens in the doctor's office. But while it's hard work, it's also heart work. And that's the most important part of this. So many of the people who do this work, whether at SSHCO or through our partner organizations, Do it because we have a personal story of a family member or a relative who needs this kind of care and couldn't get it otherwise. Or maybe they didn't get it through SSHCO's ecosystem and they saw how powerful it is. No single organization can do this alone. And that's why we have a network of 13 healthcare partners coming together and choosing to collaborate, choosing to maximize our collective impact, and choosing to be a force multiplier for the community. And when we do that, the impact is exponential. So you've heard from Kimberly that healthcare itself accounts for only a fraction of health outcomes. She gave you a statistic of 30%. The majority is really shaped by those social drivers like housing and transportation, access to healthy food. So when SSHCO screens for those needs, when community health workers knock on doors, when nurse care coordinators follow up after discharge, that's where the real transformation begins. That's why partnership matters. That's also why investment matters. We're already seeing outcomes that show when patients are connected to services and social needs are addressed alongside clinical care, success follows. So, for those of you on this call, the clinicians, the administrators, community partners, I want you to know this work matters, even on the hard days, and especially on the hard days. After, and for the Southside residents on this call, we want you to know that you deserve the very best of what our healthcare system has to offer. And through SSHCO and our network partners, we are working every day to ensure that you have it. I am honored to do this work in my own backyard alongside all of you. So thank you for the partnership, and let's keep showing what's possible when we invest in the strength of the South Side. And now I'll hand it over to SSHCO community health worker Keisha Taylor for an SSHCO mission moment. Thank you.
Thank you, Dr. Blakely. We couldn't do this work without your support. At SSHCO, we have something we call mission moments, which is an instance that reminds us why we're so committed to our mission. It might be learning that a patient finally has their A1C under control or is successfully managing their hypertension. It could be getting a thank you note from a patient whose life is measurably better through the services we provide. I'm here to share one such moment. In this video, you'll meet Sky P., a patient and a mother. As we know, Black maternal mortality rates in our country are disproportionately high. That means that while expected Black mothers are feeling the joy and anticipation of welcoming a child, they also have to deal with fear and uncertainty in a way other mothers don't. We take our patients, pregnancies, and their concerns very seriously, and we like you to hear directly from Sky about her experience with SSHCO, where her care is prioritized.
Just being able to stay on point with my health care and being able to have transportation provided for me, questions answered, it really just been making my pregnancy really smooth. This is my second pregnancy. My first one, I was actually hospitalized for 4 months before I finally, had the baby. And I appreciate Kenya. She calls and checks up, makes sure my prescriptions are on point, and making sure I'm checking my blood pressures. I appreciate the fact that it does keep me organized. It's been helping me, with Keisha booking my rides. It makes it easier for me to get there back and forth, so I'm not missing my appointments because I don't have a car. So that's a big thing for me, being able to get back and forth.
The knowledge that we can help mothers like Sky deliver healthy babies and thrive as new moms drive us to work harder. So thank you, Sky, for committing to the best care for yourself and your baby, and for letting us help make it happen. It feels like every baby our patients welcome is a part of the SSHCO family. Now, I'd like to turn it over to someone who dedicates their time to helping SSHCO succeed. And I know he has his own mission moment. Please welcome Brian Alexander of SSHCO's Community Advisory Council.
Good morning, everybody. Thank you so much, Keisha, Ms. Hobson, and Dr. Blakely. Thank you so much for your leadership. We're just so grateful to be able to serve with you all. And it's just really, really great to be with everyone this morning as well.
And I stay on you. I need to get in.
So Keisha just shared this wonderful, wonderful mission moment, and I just wanted to take a moment to just share one of my own. So I have the pleasure of serving at an organization here in the city called Project Hood. I and I serve as our director of community health and wellness here. I know we've all been to these health fair events, and it may seem kind of repetitive and redundant, but on one particular morning, there was an individual, a young lady who came in with, just randomly got her blood pressure checked, and we were able, the doctors that were there, rather community health workers that were there administering the services, were able to recognize that something really just wasn't right. I ended up calling one of the more senior care professionals, and we discovered that this woman was actually having a stroke at that very moment. So we were able to, because she came in to that particular event that she was invited to by a healthcare worker, right, quite literally saved her life. So I just want to just thank everyone on this call for your work, for all the lives that you touch. It's just, yeah, there's just no small feat as well. So with that, we're going to move on. We're going to have a little bit of fun. So if you guys are, so whether you're a patient or a resident, a care provider, you are a part of this community, and we want to really hear from you all. So inside of the Zoom chat, I want to hear from you guys, and I just have a question for you. When you think of what a healthy South Side looks like, what comes up for you? What words, what phrases really pop up for you? Go ahead and you drop those into the chat, and we're going to start to see them on the screen in real time. So again, when you guys think about a healthy South Side, what does success really look like to you guys? Oh, wow, they're already rolling in. Okay. Thriving communities, collaborative communities, longer, healthier lives, access to fair healthcare. This is all really, really awesome, y'all. Togetherness, definitely community, stabilization. That's awesome. The stabilization, you guys don't realize how much having good healthcare just stabilizes everything and enables folks to really contribute to their families in some really amazing, amazing ways. Health equity, no disparity. Amen and amen to that. Accessible primary care, no more food deserts. Wow, these are really, really awesome. Access to primary care professionals, absolutely. Yes, a sense of family and community, happy people, yes, a supportive community, affordable healthcare, absolutely. Man, these are all really, really awesome. Healthy foods, improving quality of life. Healthcare is really you guys are really at the foundation of us rebuilding our community, one person at a time. Because really, it's impossible to do if you are concerned with your healthcare as well. Healthcare as a right, not a privilege. Yes, yes, and yes. Establishing trust within your healthcare system and better access to mental health services. Someone put in more specialist doctors. Yes, absolutely. I more active communities, centers for exercise. These are all really awesome. Holding our aldermen accountable. Absolutely. Our public officials play a huge, huge role in the overall outcomes for the communities that we serve. Wow, these are really, really great. Okay, so I think you guys can kind of see there are definitely some themes that are coming out here. So closing the healthcare gaps within our communities is going to be just huge and saving lives, amazing, accessible, affordable healthcare and community empowerment. Wow, these are just all the things. I mean, there's so much here. So I want you guys to really be proud of the work that you all are doing and have been engaging in, because you guys are actually doing this work, saving lives and creating a foundation for things like financial stability, right? And health literacy and unity. I keep seeing unity a ton. These are really awesome. Man, you guys should, I just really want everyone, man, really just give yourselves a round of applause. You guys are doing an amazing job, and your presence is extremely felt within this community. And we're just so grateful to be able to collaborate and serve with all of you and make a little bit of history in the process as well. So for just wanted to just thank everyone just for being a part of this amazing ecosystem that we've created. It's only been 4 years. We are just scratching the surface of what we're going to be able to accomplish. And I'm just grateful that we recognize that there's so much more that can be done through collaboration as opposed to competition as well. So up next, guys, we have an amazing panel conversation. So I would love to turn it over to our SSHCO community health worker who is loved and adored by everyone who works with her. Everyone, please just help me in welcoming Tabitha Wilson.
Thank you, Brian. I'm excited to be here because we're going to talk about a very important subject, and that's hypertension. As many of us know, hypertension or high blood pressure is sometimes called the silent killer because a lot of people don't even realize that they have it. But over time, if it's left unmanaged, it can lead to heart disease, stroke, kidney failure, and other serious complications. Here on the South Side, we see hypertension every day because, as with many other conditions, it doesn't impact every community equally. Our residents have higher rates of high blood pressure, but more severe outcomes, and that's not a coincidence. Chronic stress, lack of access to healthy food, transportation challenges, and gaps in primary care all play a role in creating higher rates of chronic disease like hypertension. This is where our collective model matters because no one organization can solve hypertension alone. It takes alignment across clinics, hospitals, care coordinators, and community partners. So let's talk about it. To join the conversation, please welcome Andrea Dumas, SSHCO Nurse Care Coordinator, and Dr. Geeta Govindarajan, Doctor of Internal Medicine at Friend Health. Thank you both for joining me.
Thank you for the introduction.
While we share your responses, we're going to capture some of the key points on the screen for our audience. Dr. G, let's start with you. What actually causes high blood pressure, and what are the biggest risk factors you see in our community?
So first off, thank you so much for introducing us into this conversation. Tabitha, you did a wonderful job of kind of describing, the landscape that all of our patients are walking through. And as you rightfully said, high blood pressure is a very complex condition. It's not just caused by one thing. It develops when multiple systems inside the body, external and internal, are under strain for a very long period of time. If you look at it from a very integrative medicine perspective, we look at how genetics, lifestyle, stress, and environment all interplay with one another. Genetics can definitely increase, someone's risk, but whether blood pressure shows up or not, or how severe it becomes, is often shaped by our daily habits and stressors that we're always struggling to walk through, especially in the South Side. And having practiced here for a very long time at Friend Health, I would say some of the biggest factors that we see our patients go through is chronic stress, poor sleep, lack of access to healthy food. And ongoing stress really just keeps our nervous system in almost this constant fight or flight state, which raises the blood pressure and makes it very hard for the body to reset. Now, diets that we all are having access to also are very high in sodium and also very processed. And so, food is medicine in that sense. And so it plays a huge role of what we're consuming. Low levels of physical activity, tobacco use, alcohol use, drugs. And then comorbid conditions such as diabetes and sleep apnea can also further raise the risk. And the environmental social factors showing up together, like you mentioned, so the housing instability, the work schedules, access to healthcare, all of them contribute. And as you said rightfully, that blood pressure is a silent epidemic. Most of the time, people don't even know that they have it. And that's the major reason why you need to be connected to a primary care physician or a health center so that you know kind of what your state of affairs of your body is. So supporting nutrition, movement, sleep, stress management are all part and parcel of this process.
Thank you, Doctor. Andrea, walk us through what actually happens when you meet a patient with uncontrolled blood pressure. What are the first steps you take?
So, as a care coordinator, the first steps that I take when I realize the patient has high blood pressure, I just first observe their chart and make sure that it's not an emergent situation. And then when I speak with the patient, I find out how long have they had the condition. Once I find out how long they've had the condition, I go over with them their lifestyle, because lifestyle is a major part of it, like Doctor just stated. Sometimes they don't have access to the medications. Sometimes they can't afford it. And then I would also, once I find out what their background is with it, do they have an understanding of the disease process? Because sometimes they can have it, but not realize how detrimental it is for them to get help with or just be compliant with their medication regimen and their diet and just daily activities overall.
Also, Andrea, how do you help someone who says, I feel fine, so I don't need to worry about it?
So as Doctor and you previously stated, just because you feel fine, that doesn't always mean that you're okay, because as stated before, high blood pressure is a silent killer, and you can feel fine because your body is used to your numbers being elevated. So I would educate them and let them know, like, hey, without scaring them, because it is a scary situation when you are diagnosed with even the smallest thing. I would educate them and let them know how detrimental it is to go and get checked, be compliant. And also, it's not always a lifetime disease process. If you go about it and do it the right way, diet, exercise, you may be able to come off of medication. Sometimes you may not even have to take the highest medication. I've seen people before with just diet and exercise not have to do anything. And just let them know that. And most of the time, once you talk to them, I've had good responses, and they do go and get checked, and they do take it a little more serious.
Thank you, Andrea. Dr. G, we know that medication can be helpful, but patients need a whole body approach to controlling their blood pressure. What does that holistic approach look like?
I think a whole body approach really is looking at blood pressure from a variety of different systems. We understand, as Andrea mentioned, medicine is definitely one aspect of it, but obviously there's a whole host of other things that also need to be addressed. So nutritional support, physical activity, sleep, and recognizing that mindfulness practices, whether it's in short spurts or, a very sustained program like meditation, etc., all of them play such a valuable role in bringing the numbers down. Tobacco use, even if you've been a chronic smoker for a very long period of time, by reducing even 1 or 2 cigarettes a day, it has a palpable effect on reducing your blood pressure numbers. And so, as Andrea also mentioned, really, hypertension can be mitigated if we kind of take that holistic approach, recognize that you're just not just the physical body, but recognizing there is an emotional aspect of you, there is a spiritual aspect of you. All of those are very important aspects to think about as you package yourself as a being that's wants to go towards well-being rather than being in a disease state. So part of it is your own willingness to want to change for the better. and working alongside your physician and your care coordination team to sort of achieve those goals, it's possible to reverse something like this. Worked in this, I've seen my patients, reverse this process or mitigate this process, because we know that if it doesn't go addressed, then it leads to a lot of chronic conditions that lead us to the hospital system, which we want to avoid.
Dr. G, what happens to the body over time where hypertension is not controlled?
So uncontrolled high blood pressure leads to progressive end organ damage. So you can have your left side of your heart can get enlarged, which can eventually lead to heart failure. It can, impact your brain. It can increase your risk of hemorrhage or stroke. It can impact your kidneys and also your eyes. It causes retinal changes, which can impact your visual, which can impact your vision. So it's very important to understand that, the long-term sequelae of uncontrolled high blood pressure can lead to irreversible damages to these organs that are so vital for our existence. But if we take simple efforts to try to mitigate them, we may be able to stop getting to these states that allow us to, having to be dependent on medications or having to visit the healthcare system much more than we would care to. So thank you for that question, Tabitha.
Thank you, Doctor. Thank you both, Andrea and Doctor. Andrea, I'd like to close us out by asking one more question. For our partner organizations listening today, whether they're providers of clinical care or other types of services, what role do you see them playing in strengthening hypertension management across the South Side?
Well, we all play a major role. The roles that we play is just making sure that we have organizations for where the patients can go and get screened, education, make sure that they have resources. And with resources is a broad range of things: transportation, medications, blood pressure cuffs, and just being very knowledgeable of and making sure that they feel comfortable. And also what people sometimes forget is, just being able to be in a better living environment. Some people may not want to or feel ashamed if they go to the doctor and they're homeless, So just that in abroad, just making sure that we're available to make those patients feel comfortable and making sure that they feel like they're a person. That's all.
Thank you both for sharing your thoughts and reminding us of the importance of this work and how it really does have the power to change lives. Audience, now it's your turn. We've been keeping an eye on the great questions you've been dropping into the chat, and we want to get you answers. To guide us through our audience Q&A, let's welcome SSHCO board member Katina Latham, who is also Senior Vice President and Chief Community Health Transformation Officer at UChicago Medicine. Take it away, Katina.
Hello. Thank you, Tabitha, Andrea, and Dr. G for such a great conversation. This is actually one of my favorite parts of the town hall. This is when we get to hear directly from you and to get your questions. So I hope you've been putting your questions in the chat, and we'll get through as many of them as we can this morning. And so let's just get started. Happy to open it up. All right. Well, our first question we have, this will be for you, Dr. G. How do you build trust with patients who've had a bad experience?
That's a very loaded question and a very nuanced one, right? We have to understand that we have to meet people where they are. I think once they come inside the room, it's a doctor-patient relationship is heart to heart. Hopefully you're able to sort of unpack their experiences to date and maybe help make little shifts. I think I find it much easier when it's less ritualistic and more at the connectivity level. Once you make that connection heart to heart, I think, the patients start to see you as a friend, not as a physician that's telling them what to do. And I think that's what happens in that closed door behind that, once the patient comes in and you and the you and the patient get a chance. And I think when you're connecting at the heart-to-heart level, you understand that you're seeing them as a whole person, not just a diseased state or a patient with a whole bunch of medical problems. At least that's been my approach to medicine to date, and it's served me well. There's definitely, understandably, trust is something that is earned. It cannot be expected. So hopefully it's a process that works back and forth. Hopefully the patient also gives the provider an opportunity to sort of, grace, to sort of give them a chance to explain how the system works and what could be done together. So it's a two-way street, I would say. And hopefully, if we approach it at a heart level, I think you're able to, mitigate some of those concerns around the trust issue.
Thank you. That trust is so important, especially as we've talked about today, the importance of finding out what's that right path. It may be medication ritual, it may be both medication and healthy lifestyle. So being able to build that trust and have those conversations with your patients is so important. Thank you for that. So next we have a question for Keisha. So Keisha, you mentioned the rising concerns with maternal mortality. What role do doulas play in improving maternal health outcomes?
That's a great question. Doulas play a powerful evidence-based role in improving maternal outcomes, especially in communities where mothers face higher risks, like many neighborhoods on the Chicago South Side. There's that continual emotional support, unlike the medical staff who rotates, and the doulas provide that continuous one-on-one care during pregnancy, labor, as well as postpartum. This reduces stress, fear, which can lower complications linked to high cortisol and anxiety. They increase improved birth outcomes, as well as advocate and great communication for our patients on the South Side of Chicago. Doulas reduce maternal mortality and morbidity. So they do play a great role in building and improving maternal outcomes with our patients on the South Side of Chicago.
Right. And so you can connect patients to doulas if that's their preference, if
Absolutely.
the route they want to go. Okay, great. Well, I also want to tell people you can type your questions in the chat too, and we can respond directly to them through that method. But let's move on to some more questions that we have in the chat. Next, we have a question for Kimberly. Kimberly, we've talked a lot about the SSHCO and the great work that you're doing and what's ahead for you. What do you need right now from the partners from the SSHCO?
Well, thank you so much, Katina. Our partners are everything to us. We partner with hospital systems. We partner with federally qualified health centers, with the safety net hospitals, community-based organizations, churches. I mean, and the list could go on and on. And so, what we need from our partners, and I certainly hope they need that same thing from us, is for us to collaborate. I can't say that collaboration is. I heard that word earlier, and I would say that is the most critical part of improving health and wellness for individuals on the South Side of Chicago and beyond. And so what we need from our partners is for our partners to continue to partner with us, to collaborate with us, and to allow us to come into their sites, their organizations, talk to their patients, connect their patients to social supports that they need, continue to work with the SSHCO so that we can make sure that we get continued funding so that we can continue this work as we move forward. Once again, we are grateful to our partners, I should say that, because without them, we wouldn't be having the impact that we've had thus far. So our partners are near and dear to our heart. We'll do what we can to support them, and they have already shown us support, and we want to continue that partnership.
Thank you for that, Kimberly. So very important. We have to do this together and collectively. We can't do this alone. Such a big task. All right, well, my next question is for Dr. G again. Dr. G, in your talk, you mentioned a couple things for helping to control high blood pressure. Can you go and provide some more examples of how people can reduce stress?
Sure.
I know another loaded question.
No, it's
a whole
actually
seminar.
It's a very poignant question because, oftentimes we talk about it, but what is the how of it is so important. So thank you for that question. I do appreciate it. I think the simplest thing is, the one thing that we all have is our breath. I think it starts with that. So every time that you wake up or you feel like, the world's coming down on you, I always tell my patients, sit up straight. We can do this right now together if you choose to. Sit up straight, feel your breath from your belly button, and you take that deep breath, you hold it for about 4 seconds, and then you let it all out. This whole process takes less than a minute, even less than 30 seconds, really, if you do it right. And what that does in that moment of breath work that you've done, you've managed to, activate your parasympathetic nervous system, and that manages to, bring your state from a state of frenzy to a state of being centered and grounded. And breath is something that is affordable, and you can do it at your whim, if you're able to. So starting with, breath work as soon as you wake up in the morning is something that I tell my patients. Secondly, if you're able to move that breath work to periods of mindfulness, throughout the day. So even putting a little timer on your clock and saying after every 1 hour, give me a mindfulness minute break. That's also a great way to do it. 3, you can join group meditation classes that exist in the community. Number 4, exercise is another way to sort of keep that stress level down. You just take a break after every hour, walk around your workspace, and that, gives you energy. And eating, like when you're eating, it's not also what you're eating, it's how you're eating. Can we put our digital devices away, and can we sit and just eat? So that's another thing to think about, right? We multitask, we're a multitask generation. So we need to sort of say, can I just even doing that, you're honoring your body and you're honoring yourself. And finally, one other way that you can think about, which oftentimes goes along with the mental health issues, is like how we view ourselves. It's very important to view ourselves as a whole entity. So using I am affirmations is a great way to do it. I am healthy. I am, in a good space. The universe will respond accordingly. So I think those are some ideas that come to mind as you throw that question out there. And thank you for whoever asked that question. Appreciate it.
No, thank you. That's so important because I think all of us in our day-to-day, we think about this as having to carve out a great deal of time to plan the food we're going to eat, having to carve out time to do the exercise. But the examples you just gave are things that we can do every day with just our regular schedules, particularly just taking that time to stop and eat or taking the time to take the breaths too. So thank you very much for that. And you mentioned another point that I think is a good segue to another question that we have that I was hoping Dr. Sophia can ask is, the importance of the mental health, the importance of centering yourself, and how can we reduce the stigma around mental health for people to understand that that's actually a part of being healthy?
I think that's such an important question to be thinking about, and to address in our communities. I would say, first of all, I totally underscore everything Dr. G said. It was spot on. And I would say 2 things with regard to this. The first way I think we can reduce stigma around mental health is by we ourselves being more vulnerable and sharing more about our own struggles, because mental health is not unique to a certain subset of people. All human beings, just by nature of being human, are going to have moments where we struggle with our mental health or with our emotional health. And so I think oftentimes when people see folks who are like, whether it's in a position of authority or someone they see as like really buttoned up and put together, be more vulnerable and express that they themselves are also, dealing with things, it opens up the door for them to almost give themselves permission to also acknowledge those challenges for themselves. And then the second thing I would say, which is how I have approached patient care, and it's just sort of like how my mind works when I think about mental health. I really view mental health not as a distinct thing from physical health. In my mind, those two things are intertwined. And if anything, mental health is the cornerstone of physical health. And so I think by starting to change the dialogue around what mental health even is and helping people understand that there are physiologic implications to mental health. You know, to Dr. G's point, when you're stressed and your cortisol goes up, your stress hormones are increasing, that's affecting your blood sugar, that's affecting your blood pressure, that's affecting your sleep, etc. And so I think the more people can really relate to a broken bone in a cast. People can relate to I'm diabetic and I have to take meds. And I think the more we can help people appreciate that mental health has these physical underpinnings, just like everything else we relate to with health, it'll help to start reduce that stigma that we have around it.
Thank you for that. And how can SSHCO help people to find those resources related to mental health?
So our community health workers and our nurse care coordinators certainly can link folks with support, whether it's through our typically through our partner organizations. We do also subsidize specialist care at some of our sites, so people who may need a higher level of care than what a primary care provider or a therapist even can provide. There are some sites that have psychiatric support through our subsidies. But I would say the first step is just speaking with our community health workers and our nurse care coordinators and allowing them to walk them through the process to get the support that's appropriate for what their needs are.
Thank you for that. Speaking of getting help and connecting more with SSHCO, this question's for you, Kimberly. Can you share how people who may not be on the South Side can help the SSHCO deliver its mission?
I'm sorry.
Deliver on its mission.
Oh, yes. So of course, we have a specific geographic area that we serve. We serve the 15 zip codes that make up the south side of Chicago. And so what we do find, though, is that even though we serve in the south side, many times as we're in the emergency rooms, as we're in the federally qualified health center clinics, we get patients that live outside of the South Side geographic area. And so we will serve them the same way. That if they live on the outskirts, if they're just a bit outside, if they see providers and so forth that are on the South Side of Chicago, we will continue to serve those patients. And so that's our goal, is to serve the patients we interact with as we're doing our normal daily work.
Thank you.
Yeah.
As you said, you go beyond. You're there to serve the South Side, but it's to go
Yeah.
beyond for the greater needs. Thank you.
Yeah.
The next question I have, I think, would be appropriate for Alessandria to answer. We have a question in the chat about the statewide professional association for CHWs. The person on the chat wants to know, who do they talk or connect with about what's happening and updates related to the CHW work?
Yes, so that's a wonderful question. And so, Letitia, thank you for asking that. We here do have a learning and development department within the SSHCO. And so, if you can kindly provide your information, we can have our learning and development team to connect with you to provide you with any information on how to support the community health workers and anything related to educational resources.
And thank you for that.
You're
And also,
welcome.
Lasandra, we can just keep it going with more questions about the SSHCO model. How does the model of building relationship with each patient, that one-on-one connection, lead to better outcomes?
Yeah, so that's a wonderful question too. Throughout the US, when this whole community health worker ideal was thought about, a very big organization did a study to identify, well, what will get patients engaged in their care, right? Alluding to what Kimberly stated earlier. It was identified that 70% of a patient's health care does not have to do with necessarily medical costs. And so, to that extent, it was found out that patients are more compliant or adherent when they are interacting with those who look like them, who have the same experiences as them. And so, what we have done at SSHCO is we have made sure to hire community health workers who live within those zip codes that we serve, who have had the same experience, who can connect with patients to develop that rapport and trust because of the shared experiences that they have. So from there, with those community health workers, they connect with the patient, they identify through a screening process what their health risks are, right? So what are those social needs? The community health worker then focuses on addressing and supporting, right, as we've mentioned, getting that patient to with transportation to get them to their appointments, identifying which collaborative sites do we partner with so that we can provide that patient with access to care. And so looking at all of that is also the CHWs identified, but there are these medical needs. And so we then refer, the community health workers then refer off to the nurse care coordinators in which they come into contact with the nurses such as Andrea on the call today. And so it's a whole full circle is how we approach of what those social needs and medical needs are to treat the patient.
That's an important point. So no matter what your issues are, you can contact, and your first line of contact is at CHW then.
That is absolutely correct.
And they connect you to all the other resources that you needed. Thank you for
Yes,
that.
you're welcome.
For Andrea, we have a question. If you get a patient's hypertension under control, how do you keep them engaged to ensure that they maintain these new healthy habits, these new approaches that they've now learned?
So to keep the patient engaged, what I usually do is I make them feel very comfortable with me. You know, I give them different strategies to do. And once their blood pressure is under control, then we start working on something else to help maintain. It's more like it's still educational because just because you have it under control, it takes a while for it to actually be really under control from that standpoint, if that makes sense. So I have my patient because they will think that it's under control, like right away once they start getting those normal readings. And I just reinforce with them, like, hey, it's under control right now, but let's just keep talking a little bit more so I can make sure that you're in the clear. And once you're engaged with them and once you're showing them compassion and that you care, that's the way that continues to have them engaged and keep them involved, because sometimes, like I stated before, they think that it's under control, but it's really not. And I get them on a different diet regimen. I get them on a exercise regimen, and then they become like family. And sometimes I can't get rid of my patients. I'm like, hey, let me go ahead and try and graduate you and help someone else just the same way as I helped you. But I still have patients now that will call and say, hey, Miss Andrea, I had this done and I had that done. And it makes me feel warm and fuzzy all on the inside because we are a family, we're all a community, and that's what keeps the patients engaged. When you can communicate with them and show them like, hey, it's not just about your disease process, it's about you in whole.
Mm-hmm. You're right. It's a lifetime journey.
Yeah.
And
Yeah.
that's the message that I hear that you're echoing.
Yeah.
I
Yeah.
didn't know if others had comments that they wanted to share either for this question or for other topics. If I didn't circle around to you in terms of if something you wanted to weigh in on. No? Okay. Well, I think we have a couple more questions as we round out the hour here. So it's back to you, LaShandria. How does the referral process work for the social service partner. So we've walked through how you can connect to the CHW. So then how does that next step for the referral process work?
Yeah, so that's a wonderful question as all. So we make that connection as some of our community health workers are sitting inside of the federally funded clinics that we collaborate with, as well as in some of those safety net hospitals in the area. And on a broader spectrum, we do have a phone number that the community can call into. And so that phone number is 872 274 4688. And if you or anyone call into that number, there is a host of community health workers that are there to take your phone call. Once that phone call is reached or once that meeting is had within the face-to-face setting, then that member is screened to identify, well, what insurance do you have? What support, again, do you need? What social needs do you have? What conditions do you have? What are your overall holistic goals? Whether it is navigating someone to a housing resource or navigating someone to employment, an employment or school resource, whatever that need is that is identified during that screening and will serves the purpose of helping that patient to reach that goal that they called in or connected with the CHW for. And so that process or screening can take anywhere between 20 minutes to 30 minutes even. And then, of course, the more needs may be a little bit longer. Now, typically a CHW may help that patient throughout the course of 1 to 3 months, give or take, sometimes a little longer depending upon what that need is. So each patient, again, with that holistic approach may differ a little bit.
Thank you for that. Such great information and resource. And thank you all. I think I have a last question here, which will be for Kimberly. So Kimberly, after 4 years in this role and working with the SSHCO, what has changed on the South Side and what do you see for the future?
I think what has changed on the south side of Chicago is that I mentioned earlier, we see a change in our outcomes. We see fewer emergency room visits because of the coordinated care that we have delivered through our healthy community models. We see decreased acute care visits in the hospital once a person has been in our program, is in our program, or has graduated from our program. We actually see our total cost of care for the patients that have been in our programs. We see a total cost of care decrease over the last few years of over $12 million. So we are not just getting patients and improving the health of individuals. We are actually helping the ecosystem overall in terms of people being educated around how to navigate their health care in this fragmented system. We actually address that fragmented system because we have a comprehensive model that pulls all of the needs of the patients into one source, which is the SSHCO, and we actually assess patients for all of those things, and we are seeing the outcomes that we ultimately talked about when we first started. As we move forward, I want us to I foresee us, I should say, I foresee us really continuing to get funding for this work, continue to serve even more patients. This year, we saw, we brought over 5,000, almost 6,000 patients enrolled in our program. We want to continue to grow those numbers. We want to continue to increase our partnerships so that the entire South Side has their hands around this work, and we are serving our residents the way that they deserve to be served. And I believe it's helping them to live healthier lives.
Thank you for that, Kimberly. I think that's all we're done with the questions. I don't know if you want to close us out for this.
I'll just keep going then. Yes. Thank you so much, Katina. And thank you to everyone who joined us today. Conversations like this are exactly why the SSHCO exists. Because if we're going to talk about health outcomes on the South Side, which is a system level conversation, we first have to talk about the experience of healthcare on the South Side. And that is a personal conversation, which I believe we've had today. We have to hear from our patients like Sky and see how this model can make patients believe in the power of the unique person they are and give them the unique combination of care they require. That conversation is certainly needed because, healthcare is more than one thing, and being healthy and being well is more than just one thing. And so you all shared some words and some phrases with us that describe today that describe for you personally the kind of impact we can have together as a collaboration. And I'd like for those words to guide us all as we continue into 2026 and big goals to transform health on the South Side. So if you want to partner with us, sign up for services. If you want to refer someone to us or fund this work even, we want to hear from you. You can visit us at southsidehealthycommunity.com. You can follow us on social media. You can give us a call on the phone number 872-274-4688. And please don't hesitate to reach out. On behalf of the whole SSHCO team, thank you again. Let's keep pushing together for the healthier and thriving South Side our residents deserve. We'll see you in the next town hall. Thank you.